We've taken a look at the demographic shifts in the time frame 1900 to the present. What we're going to do now is not only look at the health issues, but how new medical technologies and innovations have led to efforts to combat some of these traditional issues. So 2014, the Ebola virus spread across the West African nations of Sierra Leone, Liberia, and Guinea. There were only a few cases that developed outside the region, and they were easily contained. However, panic still ensued. An American nurse was ordered to be quarantined upon her return from Sierra Leone, even though there was no medical rationale for doing so. Morocco rescinded its offer to host the 2015 African Cup of Nations soccer tournament due to health concerns. The suffering that Ebola wrought was almost entirely limited to the regions of the immediate outbreak. And once appropriate measures were taken, such as the efforts of the World Health Organization to provide up-to-date facilities in these regions, the disease and panic subsided. During this outbreak, a total of 11,315 people died. Now, the natural instinct to, in some cases, overreact to a pandemic is not misguided, because most people understand that with globalization comes increased mobility and the ability to spread diseases around the world. And, of course, various flus have spread worldwide, like the one that killed millions across the world in 1918 and 1919. So that's the Spanish flu. H1N1 and the swine flu are also examples. Another classic example, current COVID-19. COVID-19 was able to spread due to globalization and the interconnectivity of the world. Violent strains of diseases like malaria are now global because mosquitoes can find their way onto airplanes. Over-reliance on antibiotics has also caused new resistant strains of bacteria to surface, which really taxes healthcare systems worldwide. HIV/AIDS is another disease that has caused a huge shift. Now, the disease was first prominent among homosexual men and drug users, so there was a specific stigma attached to the disease when it first began to appear. And in the 1980s, there really wasn't much understanding about how it was spread, so fear and paranoia took over. Today, Africa has the largest number of AIDS victims, with 28 of the 40 million infected worldwide residing on this continent, and there are more women affected than men. In developed countries, HIV infection rates have stabilized, and those who can afford it can purchase drugs that ease the suffering. They can extend one's life and even help keep the immune system strong. In developing countries that have poorly funded health institutions and really not that many resources to invest in prevention and treatment, the situation is much more grim. Now, in Russia, new infections rose from under 5,000 in 1997 to over 90,000 in 2001. India and China in particular are considered danger zones. India currently has over 2.5 million people living with HIV/AIDS, while China has an infection rate of 0.1%, but that still means that over 1 million are infected. If it affected these areas in the same way it did South Africa, where in South Africa the infection rate grew to 25% of the population by 2005, if it was a quarter of the population like it was in South Africa, their societies would be overwhelmed. Now, most epidemic diseases target the vulnerable. So, we have the weak. But this one kills people in the prime of their lives. So there's a huge social and developmental cost to HIV/AIDS. However, despite the persistence of epidemic diseases, healthcare systems have evolved to help improve the quality of life and increase life expectancy. In examining the benefits of technology, some view it as beneficial because it gives citizens healthier lives. Others see us controlled by a technological imperative, meaning that using a technology is viewed as beneficial because there's a fascination with the technology itself. And there's this perception that new is better. And, there might be financial incentives attached to these technologies. This debate is probably always going to continue. But it certainly stands to reason that the advancement of healthcare technology has progressed tremendously in the past few decades. Medical tools for the heart have really helped lead the way in terms of new technology. In 1967, Dr. Christian Barnard performed the first heart transplant, and organ transplants are now performed on a fairly regular basis. The cardiac pacemaker helps keep the heart's electrical activity paced properly, and the defibrillator helps avoid a heart attack by maintaining rhythmic contractions of the heart. Critical care has also improved, specifically in the area of treating cardiopulmonary patients. And about 20% of hospital patients actually require some kind of respiratory therapy or support. Technologically speaking, medical imaging like CAT scans and MRI, which allow pictures to be taken of internal organs, have truly revolutionized the industry. Two men who were awarded the Nobel Prize in Medicine for their work in MRI in 2003 really illustrate how far we've come with medical technologies. Computers have also altered healthcare because there's more information available for people to look up. Look no further than WebMD. Since so many patients look up to their symptoms, it also has the side effect of actually causing them to challenge the expertise of medical professionals. And this is kind of altering the relationship between patients and their doctors. And finally, the advancements in technology that have received much attention but are not necessarily related to acute care are reproductive technology, plastic surgery, and eye surgery. Fertility issues have been partially solved with artificial insemination and what's called in vitro fertilization. Plastic surgery was initially designed to treat disfigured soldiers returning from World War I, but this has now become cosmetic, and about 12 million such procedures were performed in 2007 alone. Eye surgery is also growing in popularity as a means of correcting vision and reducing the need for corrective lenses. So despite the persistence of epidemic diseases, technology continues to evolve. It's happening on a daily basis, which is not only stemming some of the issues involved with these diseases, but it's also improving the quality of life for individuals, as doctors are better able to not only diagnose diseases, but they're able to treat different conditions.